Signs an elderly person may be in their final year. These changes are more serious than they look. You know, as we grow older, life doesn't change all at once. It happens slowly, in small and quiet ways that we often don't even notice. Maybe the walk gets a little slower, meals get smaller, and we tire a bit more easily than we used to. Most of us just smile and say, well, that's age. But the truth is, the body rarely stays silent. It speaks to us softly, gently, sending quiet messages that something deeper is changing. These little signs can appear months, sometimes even a full year, before a person reaches the final stage of life. They don't come with drama or loud alarms. They come as whispers, easy to miss, until one day we look back and realize the clues were there all along. That's why we're here today. Not to bring fear, but to bring understanding. Not to predict anything about the people you love, but to help you notice what the body is trying to say. Because when we recognize these signs early, we can care better, love deeper, and use the time we still have in a way that truly matters. So I invite you to stay with me until the end of this video. We're going to talk about 5 quiet but powerful signs that may appear in the final year of an elderly person's life. Signs many families overlook until it's too late to prepare, too late to make those last moments count. Take a slow breath, settle in, and let's walk through this gently, together. Before we begin, if you find these conversations meaningful, please take a moment to subscribe and share this video with someone who might need it. Your small action helps us reach more families and remind them that they're not alone in this journey. Now let's start with the first sign. Sign number 1, significant weight loss. One of the first things families often notice, though they might not think much of it at first, is weight loss that happens without trying. Maybe the belt feels a little loose, the pants don't fit like they used to, or the sleeves on a favorite shirt seem baggy. It doesn't happen all at once. It creeps in slowly. Most people assume it's normal, maybe just less appetite or smaller meals. But when an older person starts losing weight for no clear reason, it's usually a sign that something deeper is changing inside. As we get older, our bodies don't handle food and nutrients the way they once did. The stomach and intestines move slower, muscles begin to thin out, and the body simply doesn't use protein and calories as efficiently anymore. Even if someone is still eating regularly, the body might not absorb what it needs. Over time, that leads to visible weight loss, less strength, and lower energy. Appetite also tends to fade. Food doesn't taste the same, smells aren't as appealing, and that natural feeling of hunger shows up less often. For many older adults, meals become smaller or skipped altogether, not because they want to, but because the body quietly says, that's enough. It's not about willpower. It's a change that comes from deep within. Sometimes there are medical reasons too. Conditions like cancer, heart failure, or kidney problems can cause the body to burn more energy than it receives. Emotional struggles, such as depression or memory loss, can make someone forget or lose interest in eating. When these things happen together, they create a cycle that's hard to break. Eating less, losing muscle, and feeling weaker week by week. Families often do their best, making favorite dishes, offering snacks, or encouraging one more bite. But if the weight keeps dropping even after all that care, it's usually not about food anymore. The body is entering a slower, quieter stage, preparing for a deeper change. At this point, forcing big meals can make the person uncomfortable. What helps most is comfort, soft, easy foods, small portions, gentle flavors, and keeping them hydrated. Sometimes, a few bites shared with love mean more than a full plate they don't want to finish. So if you notice a loved one losing weight without trying, if their appetite fades or their strength seems to slip away, take it as a quiet message. It's not about appearance, it's the body's way of saying it's slowing down. Recognizing this early gives you a chance to care more gently, to prepare with love, and to make the time ahead as calm and meaningful as possible. Sign number 2, persistent fatigue and weakness. Another sign that often appears as the body begins to slow down is a deep, ongoing tiredness that doesn't go away, no matter how much rest or sleep someone gets. It's not the usual kind of fatigue that comes after a long day or a poor night's sleep. This is a heaviness that seems to live in the body. Even simple things like getting out of bed, walking across the room, or putting on a shirt can start to feel like hard work. For many older adults, that everyday energy that once carried them through small routines just isn't there anymore. This happens because the body is conserving what little energy it has left. The heart doesn't pump as strongly, circulation slows down, and less oxygen reaches the muscles and organs. So instead of fueling movement and activity, the body starts redirecting that energy toward keeping the most vital systems going. In a way, it's the body's quiet way of saying, I need to rest. You might notice that your loved one sleeps more during the day, takes longer naps, or feels drained after doing something simple like talking or eating. There can also be sudden drops in energy. One moment they seem okay, and the next, they're too tired to move or speak. This isn't laziness, and it's not something they can just push through. It's a physical change, a shift in how the body uses its strength. What makes this stage even more challenging is the emotional impact it brings. Many older adults feel frustrated or even embarrassed when they can't do what they used to. A person who once took pride in being independent may start to withdraw, skipping social visits, avoiding long conversations, or spending most of their time in silence. It's not because they don't care, it's because they simply don't have the energy. Over time, that exhaustion can turn into emotional distance, and families may mistake it for disinterest or sadness. For loved ones watching this happen, it can be painful and confusing. You might want to encourage them to be more active or to try harder, but what they really need is understanding. The best thing you can do is respect their pace. Let them rest when they need to, and create an environment that feels calm and safe. Soft lighting, gentle voices, a peaceful routine. Sometimes just sitting beside them quietly, holding a hand, or helping them with simple things like brushing their hair or adjusting a blanket can bring more comfort than any words. So when you notice that deep, persistent tiredness, the kind that no amount of sleep can fix, remember that it's not weakness or giving up. It's the body moving into a different rhythm, saving its strength for what truly matters. This is a time to slow down together, to meet them where they are, and to offer your presence more than your expectations. Because in these moments, what they need most isn't activity. It's peace, comfort, and the reassurance that they're not alone. Sign number 3, cognitive decline and emotional withdrawal. As the body continues to slow down, changes in the mind often follow. One of the hardest things for families to witness is when a loved one starts to seem different mentally, forgetting simple things, losing track of time, or getting confused in places that once felt familiar. They might start a sentence and forget what they were saying halfway through, or repeat the same story several times without realizing it. Sometimes they'll look around, a little unsure, even in their own home. These moments can be subtle at first, but over time, they become more frequent and more noticeable. What's happening inside is that the brain isn't getting the same steady flow of blood and oxygen it once did. Just like the muscles grow weaker, the brain also tires when circulation slows. That lack of oxygen affects how clearly a person can think, remember, and respond. They may take longer to find words, have trouble following conversations, or mix up names and faces. And it's not just about memory, it's about how the brain is processing the world around them. Along with forgetfulness, many people begin to talk less or withdraw emotionally. You might notice they spend long periods sitting quietly, not saying much, not reacting to what's happening around them. Social gatherings that once brought joy might now feel overwhelming. Loud noises, too many people talking, or even a lot of movement in the room can make them feel tired or anxious. It's not that they don't care about their loved ones anymore. Their brain simply can't handle as much stimulation as before, and retreating into silence feels easier. Their mood can shift as well. Some become more irritable or easily frustrated, especially when they can't find the right words or feel misunderstood. Others grow unusually calm or detached, seeming distant even when surrounded by family. These changes aren't a choice. They're part of how the brain adjusts as the body declines. For family members, this can be deeply painful. It can feel like you're losing the person before they're truly gone. But it's important to remember the love and awareness are still there, even if they can't express it the same way. The best way to help is to meet them where they are. Speak softly, use a gentle tone, and keep the environment calm and familiar. Familiar voices, favorite music, or a favorite blanket can bring comfort in ways that words can't. You don't need to fill every silence. Sometimes, just being there quietly can say more than a conversation ever could. So when your loved one seems confused, withdrawn, or quiet, try not to take it personally. These changes aren't about losing love. They're simply part of the body's natural slowing down. Offer reassurance, patience, and presence. Because even when memory fades and words fall away, the feeling of being cared for, safe, and loved can still reach them. And that's what matters most. Sign number 4. Frequent infections and slow healing. Another sign that the body is reaching a more fragile stage is when infections start happening more often and recovery takes longer than it used to. Maybe it begins with catching colds one after another, or a urinary tract infection that just keeps coming back. Some might develop pneumonia more easily, or notice skin irritations that turn into infections before they even realize it. What once took a few days to recover from now seems to linger for weeks. Families may wonder why their loved one keeps getting sick, even when they're eating well and following the doctor's instructions. The main reason is that the immune system simply isn't as strong anymore, as the blood doesn't reach tissues as quickly or carry nutrients as efficiently, so wounds and infections take much longer to heal. The skin becomes thinner, more delicate, and less able to protect against bacteria. Even a small cut or bruise can turn into something more serious if it doesn't get enough oxygen and care. At this stage, it's common for older adults to develop pressure sores, those painful spots that appear when someone spends long periods sitting or lying in the same position. These sores can easily become infected if not carefully cleaned and protected. What makes it even more challenging is that the signs of infection aren't always obvious. Many older people don't run a high fever like they used to. Instead, these subtle changes are easy to overlook, but can signal that the body is fighting something beneath the surface. When infections become frequent, it's natural for families to want to act quickly. More medications, more treatments, another hospital visit. But as the body weakens, it doesn't respond to medicine the same way anymore. Antibiotics that once worked fast might take longer or stop working altogether. The focus then shifts from curing to caring, from trying to fix the illness to making the person as comfortable as possible. At this point, what truly helps is gentle care, keeping the skin clean and dry, changing positions often to avoid pressure sores, and making sure they stay hydrated can make a big difference. Soft clothing, clean bedding, and a calm environment can help prevent irritation and reduce pain. Small acts of comfort, a cool washcloth, a light blanket, a touch of lotion on dry skin go further than you might imagine. So if you notice your loved one getting sick more often, healing more slowly, or seeming weaker after each illness, pay attention to those changes. It doesn't always mean something can be fixed, but it does mean the body needs kindness, protection, and rest. At this stage, care isn't just about medicine. It's about comfort, dignity, and helping them feel safe and at peace in the body they've lived in for so long. Sign number 5. Noticeable changes in breathing and circulation. One of the clearest physical signs that the body is reaching its final stage is a change in breathing and circulation. You might start to notice that your loved one's breathing becomes slower, shallower, or more uneven than before. Sometimes there are brief pauses between breaths, or moments when their breathing speeds up and then slows down again. In some cases, you may hear a distinct rhythm known as Shaney-Stokes breathing, a pattern where breathing becomes deep and rapid, then gradually fades and pauses before starting again. These changes often begin subtly, but become more noticeable as time passes. Along with changes in breathing, circulation also starts to weaken. The heart isn't pumping as strongly, so blood flow to the hands, feet, and other extremities slows down. You might feel that their hands or feet are cold to the touch, or notice that their skin looks pale, bluish, or slightly mottled, especially around the fingers, toes, and lips. These signs don't mean they're in immediate danger. They're simply part of the body's natural process of conserving energy and focusing on the vital organs. Shortness of breath is also common. Even small movements like talking, sitting up, or turning in bed can leave them winded. You might hear gurgling sounds when they breathe, or notice that lying flat makes it harder for them to catch their breath. This often happens because fluid builds up in the lungs as circulation slows. It can be unsettling to witness, but it doesn't necessarily mean they're suffering. It's the body's way of adapting as it slows down. In these moments, comfort becomes more important than trying to fix what's happening. Small adjustments can make a big difference. Keeping their head slightly elevated, letting them rest in a reclined position, and making sure the room is cool and well ventilated can ease the strain on their breathing. A humidifier can help moisten the air and make breathing a little smoother. Offering small sips of water or ice chips can keep their mouth and throat from feeling dry. For families, seeing these changes can be emotional and frightening. But it's important to remember that this is a natural part of the body's final rhythm. The goal isn't to fight against it, but to help your loved ones stay comfortable and calm. Speak softly, keep the space peaceful, and let them know you're there. Sometimes the most meaningful care is simply being present, holding their hand, sitting quietly nearby, and letting them feel safe in your presence. When breathing slows and circulation fades, it's the body's way of saying, "I'm tired now." Recognizing these signs allows you to respond not with fear, but with gentleness, offering peace instead of panic, and comfort instead of intervention. In those quiet moments, what they need most isn't medicine or answers. It's your warmth, your understanding, and your steady, loving presence. We've talked about 5 important signs that often appear as someone nears the final stage of life. Unintentional weight loss, a deep tiredness that never fully lifts. Changes in memory and awareness, frequent infections or slow healing, and finally, shifts in breathing and circulation. These changes don't always come all at once, and they don't necessarily mean the end is near. More often, they simply show that the body is settling into a slower rhythm, one that asks for gentler care and more understanding. It's important to remember, these signs aren't here to frighten us. They're not about predicting time, but about helping us see what's happening with clearer eyes. When we recognize them early, we can make better decisions, give kinder care, and focus our energy on what truly matters in the time that remains. I know for many families, this isn't easy. Watching someone you love grow weaker brings a mix of fear, sadness, and even guilt. But understanding what these signs mean can ease that weight. It allows us to approach this stage not with panic, but with calm, to slow down, to listen, and to be present in a way that brings peace instead of pressure. When we understand what's unfolding, we can talk more openly, plan more thoughtfully, and create a space that feels safe and familiar. It's not about stopping the process. It's about walking through it gently with awareness and care. And when families reach that place of understanding, something beautiful often happens. The fear begins to fade. There's less confusion, fewer regrets, and more room for small, meaningful moments. A favorite song, a soft hand to hold, a quiet laugh shared at the right time. Those are the moments that stay with us, long after the rest has passed. In the end, understanding these signs isn't about counting days or predicting outcomes. It's about giving the people we love a peaceful, dignified transition, one filled with respect, tenderness, and gratitude for the life they've lived. And for those of us who remain, it's about finding comfort in knowing we did everything we could, with love, with honesty, and with grace. If this video has helped you understand these signs a little better, I'd love to hear from you. Which of these signs have you noticed in someone you care about, or maybe even in yourself? Your stories and reflections often bring comfort and understanding to others who are going through the same thing. So please, take a moment to share your thoughts below. Your experience might help someone else feel a little less alone. And if you found this video meaningful, don't forget to like it, subscribe to the channel, and turn on notifications so you won't miss future conversations like this one. Every click, every comment helps us continue creating content that supports families through some of life's most tender moments. Thank you for spending this time with me today. May you and your loved ones find strength, peace, and comfort in every moment you share together.